Next, I would palpate the legs and assess for temperature along the legs and down to the feet to check for arterial deficit. Skin is of equal warmth bilaterally. Next, I would assess tenderness by gently compressing the calf muscle. Any tenderness?
No.
Any tenderness?
No.
Next, I would locate and palpate the inguinal lymph nodes to assess for enlargement, tenderness, and fixation. These lymph nodes are located in the femoral triangle of the inguinal region. Next, I would palpate the femoral, popliteal, dorsalis pedis, and posterior tibial pulses. To assess the femoral pulse, I would ask the client to place their legs in a frog-like position. And so that would bring the artery closer to the surface. And I would locate it below the inguinal ligament, halfway between the pubis and anterior superior iliac spines, and take note of the rhythm, rate, and grade. And if indicated, I would auscultate for a bruit. If I was not able to locate or grade a pulse because it was too weak, I would use a Doppler by placing gel on the end and then placing the Doppler over the pulse site. Next, I would palpate the popliteal pulse by having the client lie down and having the leg extended but relaxed, and wrapping my fingers into the popliteal fossa. Popliteal 1+, regular and equal bilaterally. Next, I would palpate the dorsalis pedis, which is located parallel to the extensor tendon of the big toe. Gotta remove your sock. Dorsalis pedis 1+, regular, 1+, regular, equal bilaterally. Next, I would palpate the posterior tibial by placing my fingers around the medial malleolus. 1 plus regular and equal bilaterally. Next, I would assess for pretibial edema by firmly pressing the skin over the tibia. No pretibial edema noted bilaterally. If there was edema, it could indicate diabetic neuropathy or heart failure. Next, if I suspected an arterial deficit, I would perform the color change test. And to do this, I would raise the legs off the table for approximately 30 seconds and then dangle the legs off the table to see how long it takes for the color to return. It should take approximately 10 seconds or less for color to return. More than 10 seconds could indicate arterial insufficiency.